All right. The mic is on. All right. Well, welcome everyone. It is a tremendous pleasure today to welcome Dr. Emre Kiciman from Microsoft Research. I'll say this is an extra pleasure because it's the inaugural joint seminar between two institutions very dear to my heart, the UCSF UC Berkeley Computational Precision Health Program and the Center for Targeted Machine Learning and Causal Inference here at Berkeley. So Emre is the perfect person to kick off a joint seminar. He is a senior researcher at Microsoft Research, and he completed his undergrad degree in electrical engineering and computer science here at UC Berkeley. And then his master's and PhD in computer science at Stanford. He's a senior principal researcher at Microsoft Research, and his research interests span causal inference, machine learning, security of AI systems, and AI's implications for people and society. And he also co-founded the DoY Library for Causal Reasoning. So we are delighted to welcome you here today and to speak to this exciting and very timely topic. Thanks.
Thanks so much, Maya. Thank you so much for inviting me and for hosting me. I'm really happy to be here today and looking forward to the discussion around this work and what might be possible with large language models and practical applications of causality in particular. I'm about to present. Most of the material in this talk is coming from a paper I published with collaborators, Robert Ness, Amit Sharma, and Chen-Hao Tan on causal reasoning in large language models. We put this paper out in last spring, and so most of, I might add a couple of comments here and there on work that we've done or seen done in academia published since then. But right now, let me just get into it. I wanted to start by explaining why I'm most excited about the possibilities here of applying large language models to help causal reasoning. And it comes down to like why it's so easy for observational studies to fail in practice. And there's many examples of observational studies failing. I mean, there's some fun examples like back in the late 90s, there was a study that analyzed some data and found that there was a correlation that they called a causal relationship between night lights and myopia in young children. The kind of, I think, mechanical idea was that the light somehow in the dark messed up the kids' eyes as they were growing up and developing, and that this caused them to have myopia. Later on, people realized that there was a common confound that was missed in the study, and that was that parents with myopia were more likely to have night lights in the house. And so that was enough to explain why kids who grew up in these households got myopia as well, obviously that genetic component. And, lots of claims around the health benefits of vitamins like vitamin C and E. It reduces heart disease, etc. And these actually led to multiple RCT attempts to replicate these studies and failed that all failed. So, and found that there was no experimental reason to believe that vitamin C, for example, actually had any effect on cardiovascular disease. And it's believed that there were multiple confounds here unaccounted for in those original studies as well. And in fact, a larger scale review of observational studies found that 52 claims that were analyzed, that none of them were actually reproduced in follow-on RCTs, and several were contradicted by those RCTs. And I think these all come down to the challenges of capturing all of the context that's important for accounting for potential biases in observational data. I'll say that these particular examples are all pulled from a list that Ronnie Kohavi has collected on his site called bit.ly/refuted causal claims. Ronnie is a big believer in experimental studies, especially in the context of like online internet services. That's his expertise, and he's very helpfully points at these results whenever I talk to him about observational studies. So that's really always a lovely discussion. Now, those studies that I cited were all from a couple decades ago, but unfortunately, these types of issues persist today. So, for example, early on during the COVID pandemic, many labs across the world started building classifiers to analyze chest scans, CT scans, for example, to diagnose whether a patient had COVID. Later on in 2021, studies analyzed the reliability of these classifiers and found that none of them were actually reliable enough to be used in practice. All of them suffered from biases that were unaccounted for in the training data. For example, false correlations due to a hospital's policy of allowing patients to lie down if they felt they were too weak, meant that a classifier didn't detect COVID, but instead detected signals that the patient was lying down. And in another study, all of the healthy patients were actually pediatric CT scans, that children weren't getting COVID at the same rate early on, and so that COVID classifier actually became a pediatric CT scan classifier. So these are all, so this is just, I want to say not that to criticize any of these studies, but just to point out the difficulty. And so what we end up having to do is rely on domain experts or teams of domain experts to really thoroughly discuss and analyze a scenario to ensure that all of the potential confounds in a specific scenario are being accounted for. And so in this talk, what I want to do is demonstrate that I think there's an opportunity for large language models to support and reduce the burden on the human domain experts. I'm going to talk about two fundamental challenges that require human input today. One is assumptions for building a causal argument, things like creating a causal graph or identifying known relationships between variables in your data sets. And secondly, show some promising results about reasoning over unstructured data like text, where text claims, where we can start to use large language models to bring in domain expertise that's relevant to understanding, for example, questions of normality, necessity, sufficiency, for example. And we'll show that I'll show examples of how LLMs are good in exactly these tasks that need human input. You know, what are the results for recovering a causal graph, for example, that's to help design a study, results on counterfactual inference from text scenarios, etc. But I want to point out that there are interesting error scenarios. I'll talk about some of those examples. I think this points to the promise of combining large language models with our existing causal models in methods in principled ways. I think this is a big opportunity to accelerate our ability to do causal analyses that are reliable across many fields. So large language models and causal relationships, that's part one. And here I'm going to focus on two kinds of experiment that we did with large language models. First we looked at a very simple scenario where we have pairwise relationships between two variables, but we don't know which direction it goes. So we're given a variable A and a variable B, and our task is to figure out whether A causes B or B causes A. This is something that conventionally has been done in a data-driven manner. And we're going to try and do this task in a more knowledge-driven fashion. Then the second more complex task is going to be, can we recover the full graph? If we have a set of variables, can we identify all the relationships that would create a DAG over these variables? And then we could analyze and use as the basis of a more formal causal analysis. This second one is a little more complicated because we not only have to worry about whether there is a path that connects, variable A and B, we also have to consider whether there are any mediators. So we have to distinguish between direct and indirect relationships, for example. Let's see. So starting with the task of pairwise causal recovery or discovery, depending on your perspective, what we do is for each pair of variables, we prompt the LLM to answer a simple question. Does changing A cause a change in B? or does B cause a change in A? And we can ask this question in a different fashion. Just to give you a sense, I have two examples here where we ask each question separately, or on the right-hand side, we give it as a multiple choice question, which statement is more likely. And we evaluate this approach on a couple of different benchmarks. The first benchmark we look at is called the Tübingen benchmark for pairwise relationships. And this benchmark is designed to test data-driven methods for causal discovery, where you look at like the residual error in the underlying data to see which direction the influence might be flowing between variables A and B. We're going to ignore that data, so we're not going to do the same task, but we are going to take advantage of the fact that this benchmark has 104 variable pairs across a wide variety of domains, from zoology to basic physics, and gives us a label of which direction the relationship goes. So, for example, we're going to ask, does organic carbon in soil cause clay content in the soil, or vice versa? Does drinking water access cause infant mortality, or vice versa? And this is a challenging task. Data-driven discovery methods achieve about 70 to 80% accuracy in general. The best one on this benchmark is 83%. And when we go to our large language model, we find that they do much better. Certainly GPT-4 does much better, achieving about 97% accuracy. So on the top, we have our data-driven methods, and on the bottom, we have the LLM-based methods. This should not be taken to be this should not be taken as a direct comparison here, because they are approaching these tasks in completely different ways. In particular, we believe the large language models are primarily relying on the fact that this relationship is already known and has been written about somewhere on the internet and incorporated into the large language model's training data. So it kind of knows the answer in a sense already. If we went and gathered data for some completely new relationship, something that had not been studied before, and where we did not have a prior understanding of the relationship between these two variables, I would expect the large language model not to be able to give us an answer, while the data-driven analysis would still be able to look at the data and tell us something. But still, when we're talking about what we're asking a human domain expert to do when we are crafting a causal analysis, this is exactly the realm we're in. We're asking the domain expert to bring their existing knowledge of what's already known to help us structure the analysis. Now, what about those extra 3–4%? What are those errors? And some of these errors are actually ambiguous features. So where there's some kind of misunderstanding. So for example, here I'm showing one of the questions from the Tübingen benchmark, which focuses on the relationship between ozone concentrations and radiation. And the question is, does ozone concentration cause radiation, or radiation cause ozone? And the Tübingen benchmark says that radiation causes ozone concentration. The LLM said that no, ozone concentration causes radiation. And it turns out it's a misunderstanding in what we meant by ozone and radiation and what the LLM understood. One part of our prompt asks us to ask the LLM to describe its reasoning a little bit, and it says a little bit more about the setting, and it makes it very clear that it's talking about ozone in the stratosphere and UV radiation. And so we can actually correct it and say that we're asking about ground level ozone concentration and radon. It turns out, yes, that radon does cause ozone at ground level, and it answers that. Now, we have done additional kind of probing of this and trying to find new strategies to more generically identify these types of scenarios. And one promising approach does seem to be simply asking for every pair of features, is there any ambiguity in the interpretation of these feature names that would cause you to change your opinion, right? And then it'll give that answer if it exists. And this is a real, pretty common, actually, occurrence that there's some ambiguity, especially if you're just taking column names from a spreadsheet, for example. Like the other day in one of our analyses, I was looking at building the graph, and there was a gender column that was labeled as sex. And does sex cause heart attacks was one of the questions that came up here. And it said, well, sexual activity. It said no. It said it's plausible, but they said the most likely answer is no. But really, it was supposed to be, does gender have a causal relationship with prior heart attacks? And so that's one where we want to correct that ambiguity. We continue these types of experiments across more complicated data sets. So while the Tübingen benchmark gave us pairwise relationships, we also looked at a neuropathic pain data set that had a larger graph of causal relationships, where we could ask about cause and effect across the graph in a much larger setting. And here, again, GPT-4 did quite well with 96% accuracy. And then we also looked at an additional benchmark with Arctic sea ice data. And again, GPT-4 was doing quite well. When we went to do full graph analysis, you can see details in the paper, the full graph recovery did actually do better than many approaches, but did not quite approach the 90% rate. It was a couple, I'm going to cite the wrong number if I try to cite it now, but because of things like accounting for direct and indirect relationships, it was a little more complicated. In particular, you couldn't just combine all of the pairwise relationships to get the full graph. You get it too dense of a graph when we did that. Okay. One important question is about the construct validity of this type of experiment. Is the benchmark itself simply memorized? And that's hard to know because we don't know what training data set was used by OpenAI for these models. But we can get a very strong hint by asking the LLM to reproduce the raw benchmark data that's on the internet. So we took the Tübingen data set, which is stored in a CSV file representation, and we asked the LLM to complete every row. So we said, we said specifically, here is the data set we're asking you about. You are an expert that has memorized all this data. We're going to give you the beginning of the row, 1, 2, 3, 4 cells, however many, and then we're going to ask you to complete it. And sure enough, it actually did reasonably well at this task. GPT 3.5 was able to accurately recreate about 60% of the cells and about 20% of the rows. GPT-4 did a little bit better, getting about 25% of the rows perfect. So it's clearly the whole data set was in the training data for the large language model. It's, you can interpret this as we happen to get 20% of the rows back, so maybe there's some randomness, or you could say it only memorized 20% of the rows. I'm not sure that makes a big difference for how we're going to interpret these results. But what we did when we kind of sat back is realize that this means that we're not testing the likelihood that the knowledge is known by the large language model, because the whole benchmark has been learned. That means that we can't take, for example, the fact that we have variables from zoology and basic physics and soil ecology, et cetera, and say, wow, this means that we have features across all of these fields in here. What we do know is that, okay, given that this information has been read by the large language model in its training data, given that, it's able to take that data and convert it into an answer to a causal question in R format. And we see this repeated both from CSV file format, where you can see that this CSV file format never uses the word causality. It just has like a little arrow that goes towards the right or the left. It's translating presumably from that format into what we're asking. In the neuropathic pain data set, it's more of a JSON format that actually spells out the graphical relationship. And then the Arctic sea ice data actually was more of a binary format, and the raw text wasn't actually out on the internet. So what we're testing here is the probability that if some knowledge was read by the large language model, can it be transformed into an answer to our causal question? And we are perfectly happy to rely on domain knowledge having been read previously by the large language model. We're not asking it to do any causal reasoning, any more complex reasoning than that to satisfy this task. So we think this has really powerful implications for causality in practice. I mean, all valid causal analyses depend on having a causal graph that you trust. And so given a problem, we can use this large language model's functionality to generate a candidate graph, which we then validate with an expert, hopefully in much less time. We can be more interactive and use the large language model as a brainstorming tool. Or we can use the large language model to validate or critique graphs that were generated by experts or a mix of experts and data-driven discovery algorithms. And what else can LLMs do? They can continue to help us in many of the other tasks where previously we've relied entirely on humans. For example, suggesting missing confounders that aren't in your data set at all, suggesting instrumental variables, or suggesting negative controls. And we're building out a library of prompts in a Python library called pairwise LLM to kind of help with this, and hopefully a place where people could share experiences with different kinds of prompts. To give you a sense of one of these case studies, in the paper I have in the appendix section a conversation about negative controls, where I described a vaccine study where individuals were given a vaccine, and we wanted to use this data to identify whether the vaccine was actually effective, and asked it to identify potential negative controls that would help us understand or validate whether our matching, for example, was sufficient. At first, GPT misunderstood at least my intent and gave examples of factors that were not caused by the treatment. So you should look at your control and treatment groups, and they should have the same hair color, they should have in expectation the same blood type across the groups, which is true, but I was hoping for something a little more specific. And so I said, well, what if we actually have longitudinal data, for example, about whether someone is getting sick or not. We have measurements over time and not just once. And then it starts to give reasonable answers that individuals with pre-existing immunity should not be affected by the vaccine, perhaps, or non-responders, or once it knows about time-bound, about our longitudinal data, it says, well, you should check the pre-vaccination period if you assign treatment before they actually get the vaccine, and then we can look at the short time window post-vaccination as well. And this last one was the one I was hoping to get at, and getting at it in a couple of questions was really promising. Now, how to do this and repeat this systematically across studies is an open question, but I think that this possibility is really exciting. I'd love to get help brainstorming negative controls more often. So the takeaways is that LLMs enable this kind of knowledge-based causal recovery or discovery, and provide quite strong performance for pairwise causal relationships across a variety of domains. Full graph recovery has some additional challenges, but also it seems like it's quite doable. Actually, recently, Amit Sharma, my collaborator, has been doing additional experiments and realized that oftentimes we don't need to recover the full graph. We can go straight to identifying confounders And that's a bit simpler than going through the full graph recovery process as well. Because we see that the GPT models have memorized some of our benchmarks, that means we do have to be careful in how we interpret that data. We can't say we have an arbitrary data set of features from some new domain we've never tested in and believe that we're going to get 97% accuracy. That high amount of accuracy will at a minimum depend on there being data out there about those relationships that's been read by the large language model, and we don't have a prior probability for that other than believing that it's read everything, which is obviously not a real probabilistic or statement. Okay, so when next I wanted to go a little bit into is it 212? No, 228. Okay, the clock here is wrong, and I thought I've never gone through these slides that quickly. Okay, great. So, okay, let's take a look. So, there's this motivating scenario where often the causal questions that we ask aren't actually questions about a full population. Actually, let me skip ahead a little bit. So we often are not asking about inferences over a population in many of our causal questions. There's, we do care about the average treatment effect of a drug on patients with a particular disease, but we, in many other cases, are interested in something that's more like actual or event-driven causality, where we want to do inference over a single event. We want to know Bob smokes and Bob has lung cancer. Did Bob smoking cause his cancer, right? Sure, on average, we know that this is true, but what about Bob specifically? And this shows up across domains, in advertising, in business decisions, and other policy decisions. A doctor washes their hands before surgery. Maybe we want to know what would have happened if the doctor hadn't washed their hands. And the answers to these questions require a lot of require us to formalize a lot of context, and for that we often we rely on on human domain experts again. Okay, so one of the examples that got me very excited and helped me realize why other people were excited about large language models. So this was early on when I hadn't gotten too hands-on with it myself yet, was this example from Peter Lee's book with Goldberg and Kohane with Isaac from Harvard about what LLMs might mean for medicine. And this is one of the sample conversations they had in their book. They described the information that was in an electronic health record about a 12-year-old girl who came to the emergency room with a 1-week history of worsening swelling. There was also blood in her urine, etc. And they go through a bit of this history and then ask, this might have been a standard question, I'm not sure, but they said, well, what's likely to happen? What are we likely to see in these studies? And GPT-4 seems to actually be showing that it can understand concepts from this text and reason somewhat causally about what's likely to happen from this. And this made me realize, okay, this is not the type of data-driven causal analysis that I usually do, and yet it seems quite valuable and certainly is causal. At least if a person was doing this, we would think it was causal reasoning. And that made me think, okay, this is a very different type of causality, and what does it mean if an LLM helps here, and is there connections between these two different types of causality? So coming back to now these examples and the difficult, why are these examples difficult for us to use technological tools to support? There are like logical reasoning approaches to these types of tasks, but they require us to translate from that English language into something that's more like first or second order logic in order for us to solve the answer of like what was responsible, how do we attribute blame, what's going to happen next. And this relies on us writing out statements that formalize a lot of challenging causal context examples. For example, what factors are relevant to the causal question? Like, the doctor washed their hands. What would have happened if they didn't wash their hands? Well, are they actually going into surgery? Like, that wasn't mentioned in the question, and yet is very relevant to understand, like, what's the right or expected understanding of what might happen if the doctor hadn't washed their hands, right? That statement makes no statement about makes no mention of things like bacterial infections, and again, that's something that we have to pull out of our domain expertise. That if the doctor doesn't wash their hands, even though the question never brought in this external concept of infections, that's something that has to be brought in, is very important for these scenarios. Questions of like whether a particular cause is necessary for an outcome to occur, whether it's sufficient for an outcome to occur, and in some cases even much softer notions of normality and intention end up being very important depending on the question we're asking. Like if we ask, did the doctor's actions cause the patient to die? Then, oh, apparently I lost the Zoom. What happened to Zoom? Do you have the Zoom meeting ID again? Oh. It's almost there. Great.
They're still there. I can hear everything.
Okay, great. And I think the screen is sharing too now.
Oh, great.
All right, great. And yes, and so these are much softer questions that are important for a specific, depending on our specific causal task. Like if we want to attribute whether, for example, a doctor's actions caused a patient to die, an important factor that we consider as humans is whether the doctor's actions were normal. Did they follow norms like standard operating procedures or not? And if they did, we might say, no, it wasn't the doctor's fault, it was the disease. But if they do something unusual, then we're more willing to say that it's the doctor's actions that caused the disease. And that's even if in both cases there is a relationship between what the doctor did and like mechanistically what happened to the patient. Okay, so in our experiments here, what we decided to do was start trying to decompose some of these contextual questions and ask whether the LLM seemed to be able to understand the text and come up with an appropriate response that indicated that it at least understood the high level concepts that we wanted to that we would want to use in the context of a causal task. So the one that we looked at first was counterfactual reasoning. That is, whether the LLM is able to generate a counterfactual outcome when we ask a question. So here we use the CRAS counterfactual reasoning benchmark that provides a scenario and then a counterfactual question and then a set of possible multiple choice answers. And here we found while up to now automated approaches have been slowly increasing in quality, that GPT-4 has made a significant leap to get about 92% of these scenarios correct. That's compared to a human annotator that gets about 98%. So not quite at a human level yet, but great progress with LLMs in the last year or two. Looking at questions of whether LLMs are able to identify whether a particular event is a necessary event for a specified outcome or a sufficient event for a particular outcome. We used two additional benchmarks, one that was previously published in 2021 that distinguishes between scenarios that say have overdeterminism or complicated, for me, topics like late preemption, and then also generated a second benchmark inspired by this that was novel and so therefore could not have been previously seen by the LLM in its training data. And here we found that again that GPT-3 was doing okay with 40 to 60% accuracy in identifying the necessary and sufficient causes, but then GPT-4 suddenly jumped about 85 to 90% accuracy in identifying what was necessary and sufficient. These are key kind of fundamentals for that we would want to extract from a text scenario to help us analyze that information for a causal task like attribution in one of these scenarios. So we see that there's substantial improvements in the large language model's ability to perform counterfactual reasoning and also identify some of these key causal concepts from the text in ways that weren't possible before, relying heavily on domain expertise that isn't captured very well in other more structured approaches. And so this has me actually quite excited about this new frontier of causality. So I think that what this opens up to me is now an ability to take all the parts of the causal process or the causal roadmap that we previously would rely on a human to perform, and say, we can take our computing machinery and now expand it from just focusing on the algorithmic or statistical aspects, and now actually provide technological support across the whole spectrum, and potentially even going up higher now with the ability to do textual reasoning. Now we might be able to go from go all the way up to very high level questions and use this type of information to decompose it into specific RCTs or specific causal questions as well. What are the multiple experiments we need to run in order to understand a particular phenomenon? So what's new? LLMs are providing domain knowledge that was only available via human experts before. I think that's very exciting, and provides a new capability to extract primitives from text-based scenarios. What's not changing is also very important to mention, and that's the need for rigorous and well-documented verifiable analysis. So it's not enough to just use a large language model to run a black box analysis in any scenario, especially for critical and high value tasks. We need to be able to see what the large language model was doing. And so I think there's the right approach is going to be to integrate this information with human experts and their oversight and our existing statistical machinery for answering for analyzing raw data. The implications for practitioners is going to be in how we decide to use these LLMs to augment human expertise. What are the specific tasks that are going to help the humans best, say, create graphs or identify robustness checks that they should run? And then what does this look like from an interactive point of view? And what are the implications for the teams you bring together to answer these challenges? I think that these all lead to very fascinating new research questions. What are the details of how we combine these knowledge-based and covariance-based approaches together? What are other tasks that we can, where we can use large language models to, help us understand, like, say, IV variables or partial graph effect estimation, and then how do we how do we then go further and in systematizing how we apply causal analysis to a particular scenario? Can we go more broadly? I highlight here also the human LLM collaboration. I think that this is a broader topic than causality, but exactly how people are going to work back and forth with these AIs, I think is going to be a critical factor in whether or not we get the kind of reliability that we want. We certainly don't want humans over-relying on LLMs if we don't believe that they're entirely trustworthy. And so we need to figure out how we're going to ensure that we approach it with the right degree of skepticism as well. So in conclusion, I think I started this talk by mentioning how critical human domain knowledge was for causal analysis. And I hope I demonstrated that there are important signs that make us think that LLMs can start to mimic this capability in ways that we can then use to help domain experts in what, in practice, in our experience, has been a place where people fall over the most. When they're using our open source tools, for example, the place where they have the biggest problem is not choosing which statistical estimator to use, but in drawing their causal graph in the first place. I think that this is going to reduce the burden on human domain experts, make these observational studies broadly much more reliable, and I think that make them much more applicable to a much broader set of scenarios by combining, using LLMs to expand these approaches to more text-based analyses too. I think that's the end of my talk, and I'm happy to take the rest of the time for discussion and questions. Thanks very much.
We will open it up to questions and
First, thank you for the talk. It was great, and I read your paper and it was great too. So I have a lot of questions, but I'm gonna just make a few. So one important aspect of causality, as you know, especially in medicine and healthcare, is the temporality of some of the variables. And in our experience, I work with Ahmed Allah here, and in our early experiments show that LLMs kind of struggle to understand temporality, and especially when you're trying to give a treatment, and if you give the treatment today, the patient dies tomorrow, most likely was not the treatment, but the LLM was predicting it was the treatment. Have you tried to incorporate this into your experiments, or
no? Other than describing the limited amount of discussion around temporality in the context of that negative control for the vaccines, I haven't looked at temporality in LLMs yet.
Okay,
that's a great observation.
Other questions?
Hi, based on the work that you've done in this realm and the work that you've read, is the accuracy normally reported in terms of this multiple choice format, with the ability to,
Yeah, the multiple choice format is primarily used, I think, as a convenience for the benchmark so that you don't have to parse out and understand the English language response, because then that becomes its own type of challenge for large language models, or for a human to go through and manually score.
Yeah, totally. It just seems weird because the human doesn't engage this way with chat, and then you're also giving it the answer.
Yes, yeah. The more sophisticated, like there are some benchmarks where you will put a buffer in where you have a second model that reads the answer and maps it to a specific multiple choice. Those are a little bit better, but you have to realize that you're testing the combination, the combined system together. And then I think some very kind of ambitious folks, I think, go and do human scoring each time.
Yeah.
And that is difficult to do continually.
Totally. I get it. It makes sense to streamline the process.
I guess the last approach is, as we start to see these LLMs being deployed online, there's also the opportunity to monitor behavioral metrics of users to see if it seems to be answering their question.
Cool. Thank you.
Yeah, so I was wondering, are you aware of any, like, let's say causal and like neural network architectures that, like, I guess, like causal aware LLMs, where the training data and the objective function actually try to target what is really the causal task? Because I imagine like the LLM from ChatGPT, I think, is trained really on observational data with no care for causality. And I could imagine if we are able to use an objective function that is truly causal, that such an LLM would, for one, probably perform better. And also as like maybe as a medical professional, I'd be more likely to use it. So
this is a really interesting like topic, because we're not, so when we're writing down scenarios in English that describe a causal situation, but then the model is being trained to predict the next word. And so if there's a causal model that's being learned, it's what words are causing this next word. And so it's like thinking at like the NLP or linguistics aspects of it, it's difficult to say that that's the same version of the causality that we would want, at the semantic level around like a medical scenario. And so it's not clear to me that the model itself is going to be capturing the causality of the world versus the language. But then at a meta level, it is capturing that information, and then able to, if it's seen a sufficiently diverse set of content, able to find some mapping, but it's not clear to me what that mapping is. There have been studies where people have, I don't believe, fine-tuned the large language model, but I'm not sure exactly about that. But they have run large language models through benchmarks where they've specified very clearly all the information that would be needed for an expert in causal analysis to reason causally over the scenario, and like abstractly say, yes, A caused B or not, while accounting for confounds and the rest of it. And in those tasks, the LLM was not able to do very well. And this is partially explained, I think, by other studies that have shown that the LLMs seem to rely on the semantics or the embedded representations of the underlying words. And so replacing the word's meaning with an abstract like variable name removes is no longer the same thing to the LLM. And that's a fascinating paper on LLMs being contextual semantic reasoners as opposed to abstractive reasoners. And I think we have a lot to learn here. I think it's just what it comes down to. But to your question, I don't think people have gone super deeply into learning fine-tuning causal language models to be specifically for the causal task.
We'll come back to some questions in the room, but I know there are a few questions online. Unfortunately, we don't have the ability to amplify people's voices on Zoom online. So if you do have a question or comment, please enter it into the chat. But meanwhile, we will read this one.
All right. So, Emre, you mentioned that LLMs could be used to build a knowledge graph. However, given that LLMs have a hard time producing provenance, how likely is it that they will do a good job at building a trustworthy knowledge graph?
It's a great question. So far in our experience, it's done well, but we've probably only asked, like, even though we've looked at a broad set of benchmarks, we've probably only asked things that are relatively popular and so unlikely to be solicit like unfactual or ungrounded responses. The concern would be if we happen to ask a novel question that has not been answered, then is it going to respond incorrectly just to have given a response? And in those scenarios, it's true that other usages of large language models have had problems with ungrounded responses. And so it's likely that that'll occur here too. That's one of the reasons why I think we need to maintain domain expert validation and oversight over these graphs, or use them as auxiliary tools like brainstorming tools. However, we are seeing a lot of advances in detecting these hallucinations and even mitigating them more strongly. So there are, for example, methods to perturb the internal weights of a large language model in order to identify whether the internal training set of the large language model is causing a particular outcome, or whether it's coming from some grounding source that has been retrieved, say like in a web search-based retrieval. So there are methods that I think will help us in this scenario too.
Hi, thanks for the talk. I'm just following up a previous question from this lady. So about your evaluation method for the multiple choice type of questions. So I'm just wondering, when you calculate the accuracy, did you say shuffle the order of the choices and see if an ensemble the answer the accuracy? Because LLM is known to be sensitive to the ordering of those choices, and also it's kind of a test for memorization as well in some sense.
I think we randomized the multiple choice responses, but we didn't repeat them or run. I don't know that we repeated the experiments with different randomizations. I'd have to check.
So I think we have, I know Jennifer Chase is online, and I think she has a question or comment, but we're not able to unmute her. So Jennifer, if you hear me, type it into the chat and we will, and meanwhile, we'll take one more question from the room.
Hi, I think this is very cool to see, but I also have a question about the human feedback part for the LLM. I'm just curious that, because it seems that to evaluate whether the response from the LLM is ultimately good, we still need the human intervention part, either to let the human provide a clarification of the previous question so that you get a better answer. I wonder if the role of the human actually serves as like a mediator to some extent, so that you are amplifying the part of the domain where the probability of you receiving a good answer is higher. Or if you restart your question to the model and then you give the model the question together with what you supplemented before, I feel like the human input part is still, it's just a better prior that you used. So in both scenarios, I feel like, yes, as a result, maybe the model gave you a good response, but I wonder how could you show that this model is intrinsically just quality level better than other models in terms of solving causal tasks?
Mm-hmm. I think at this stage with where we are with large language models, I am not super interested in them solving these problems on their own. I don't, like, whether it's hallucination or some other ambiguity, I wouldn't trust them to solve it on their own, even if they were doing it pretty well. Certainly not for important tasks. Well, so even though we're testing the model here to show this promise, I think the practical application is going to depend on testing the human and the large language model together, kind of as a team or part of a process. And then at that point, whether it's, the human's hints seem to be critical for the large language model to come to the right decision, or vice versa, is something that you'd have to decompose, but less important as long as the two together are doing better, either in terms of results or speed and effort than the human experts alone. So there is going to have to be some, I think, we're going to have to refine what we mean by this interaction, and I think it'll change over time too, as people learn how to use these systems and as the large language models themselves become better. But I don't have a strong, I guess we do know that the human input will bias the large language model's response. So what you're saying is quite plausible. But as long as they work better together than the humans would have done on their own, I'm okay with that, I guess. This is the practical part of me says, yeah. Does that answer your question?
Yeah. Okay. Wonderful. Well, let's all give Emre a round of applause. Thank you so much. That was fantastic and thought-provoking. Thanks so much for joining us, and thanks to those online as well.